Liz Bates. Well, now, how soon can we expect the mass vaccinations to begin driving down the numbers of people dying with the virus? As of the 12th of January, more than 2.4 million people were vaccinated. If this current rate of vaccination continues, then the 13.9 million most vulnerable people that Boris Johnson has committed to vaccinating will all receive their first dose by the 16th of March 2021. Modelling conducted for this programme by Professor Carl Friston of the University College London suggests that if an average of 58,000 vaccinations a day can be delivered, 12.1 million older people can be vaccinated by the 1st of March. The modelling suggests that those vaccines could be a factor in reducing deaths this winter. By the 31st of January, daily deaths would be at 296. By the 15th of February, they would be at 137. By the 1st of March, through a combination of vaccination and restrictions, they would be down to 92 per day. Well, I'm joined now by Professor David Spiegelhalter, Professor of Risk and Evidence Communication at Cambridge University. Professor Spiegelhalter, thank you very much for joining us. Politicians and medics alike are talking of numbers rising all the time. Today is an example, and worsening next month. Does that tally with your own research?
Actually, the one thing that does look as if cases might very well be levelling off. But of course, they have longer term consequences. It would mean, if that were the case, that hospitalizations would start leveling off maybe in about a week, 10 days, but deaths are going to keep on going up for about another 3 weeks, I think, in spite of the figures you've just shown. I think it's very plausible. Deaths at the moment are running perhaps about more than 800 a day. The 1,200 reported today was taking up some of the reporting delays from the weekend. But I think just from the people currently infected, we could expect deaths to rise to more than 1,000 a day before the end of the month. It's a very tough time. But as you said, with millions of people now having the first dose of the vaccine and it rolling out, really quite dramatically, we should see that start having a noticeable effect in February and a steady improvement in hospitalizations and deaths throughout February and March.
But overall, is the vaccination programme the panacea that everybody's looking forward to? I mean, is it realistic to think that you can have such a dramatic impact?
Yes, it is. I think, one of the things that we've known throughout this virus is the enormous gradient in risk, with older people having 1,000 times the risk of younger people. And the strategy of prioritization is focus on these higher risk groups and vaccinate them as quickly as possible. It's specifically targeting hospitalizations and deaths. And as more and more of these older groups and people with medical conditions are vaccinated, then 90% or 70 to 90% of them will be prevented from getting the virus, getting the disease, and therefore being hospitalized and deaths. No, it is going to have a dramatic effect. It is quite extraordinary what we're going to see, I think. But until that happens, the NHS is going to have a massively tough time over the next few weeks.
Now, the Office for National Statistics has today said there have been more deaths from COVID than civilians killed on the ground in Britain in the whole of the Second World War. In what way is that a useful statistic, if at all? Is it merely going to enable us to place this in history?
I think it is sort of helpful. I mean, also the total number who died this year, registered this year, is about 600,000. That's 75,000 more than over the last few years. And that's the sort of jump there was in 1940, or slightly less than that, in civilian deaths alone. And so I don't think we can make a direct comparison, except to say that this is comparable to that cataclysmic event. More, as you said, more people have died from COVID, and that means died caused by COVID, not just dying with COVID on their death certificate, than civilians were killed in the Second World War. And it does provide a powerful image for just the, just the casualties that have happened this year.
And very briefly, what does history tell us about how quickly we could recover from this? I mean, do we compare recovering from the Second World War?
Oh, I think history has got some interesting lessons. Many people are talking about, what, after COVID, what do we expect? How are we going to rebuild the world? Remember, in the Second World War, the planning for the welfare state, Beveridge Report was all going on at the darkest time of the Second World War in 1942 and 1943. And I think it is very appropriate that at this absolute dark time, possibly the darkest in the whole of the pandemic, that we are thinking that we've got some of that Beveridge spirit, and we are thinking about how in the future we are going to try to make sure that it's not the most deprived members of the community who suffer the most in the future.
Professor David Spiegelhalter, thank you very much indeed for talking with us.